All right, so we get to look at another abnormal walking pattern in patients. When a patient comes to, especially the orthopedic clinic or the neurological clinic, it's always nice that I tell the patient, okay, stand up and walk a bit. So probably sometimes you mustn't actually even ask them to walk. The way they arrive to the clinic, you are observing. So one of these gaits is what is known as a spastic gait. When they say there's a spastic gait, it simply means the person don't really have that liberty of flexing their joints. Do you understand? Like they can't actually take their leg up and down. Everything is just stiff. So spasticity is just another name for being stiff, So spastic gait, a lot of things, right? This one too could also be due to stiffness, but this one is associated with stroke. I think stroke, right? Or Parkinson's. So there's a way the person can't flex their leg, so they now take their leg in a semicircle. I remember my dad had this issue, okay? It is related to stroke and Parkinson's even. Not really, it's mainly stroke, Parkinson's, there's a way the person is stiff, the person is walking small steps, and they're taking one step to the front, they're taking it to the back. They call that a shuffling gait. You understand? We'll get to talk about all those gaits, right? So spastic gait, you could see, everything is stiff. So it's a walking pattern. It's caused by damage to the brain or the spinal cord. All right. So it leads to stiff, rigid movement and difficulties coordinating your steps. So muscle stiffness and weakness are the key features. Muscle stiffness and weakness. So legs feel rigid due to increased muscle tone. Unilateral spastic gait. One leg is extended and plantar flexed. The arm on the same side may be flexed, and the person swings the leg outward in a semi-conduction. Okay, so because I'm not able to take my leg up, I'll just find a way to actually do, So bilateral spastic gait, this is when two legs are actually stiff. So when they are stiff together, they scissors each other. They call that a scissors gait. You understand? So that's what we got. This is spastic gait. So what are the conditions that are related to spastic gait, which is the most important part of this lecture? It's usually caused by what? Lesions in the corticospinal tract, and this is the tract that actually makes it that, okay, I'm able to move my leg the way I want, I'm able to go here, I'm able to come back. But if there is a disconnection in that tract, there's no more connections or communication again. So cerebral palsy, stroke, just like I was saying, multiple sclerosis, brain tumors and abscesses, and also some conditions like the Sturge Weber syndrome. So treatment does include physiotherapy, medications, botulinum toxin injections, orthopedics aids like all those embraces, the splints, the walking support, severe cases, tendon release surgeries.